Inflammatory bowel disease, IBD, is a term for two conditions, Crohn's disease and ulcerative colitis, that are characterized by chronic inflammation of gastrointestinal GI tract. Ulcerative colitis features, limited to the large intestine and the rectum. The inflammation occurs only in the innermost layer of the lining of the intestine. It usually begins in the rectum and lower colon, but may also spread continuously to involve the entire colon. Ulcerative colitis symptoms include, as the lining of the intestine becomes inflamed and ulcerated, it loses its ability to adequately process food and waste or absorb water, resulting in diarrhea, crampy abdominal pain, urgent need to move bowels, sensation of incomplete evacuation, rectal bleeding, anemia, if unchecked. The longer the person with ulcerative colitis remains in remission, the less likely the patient is to experience a flare-up of the disease in the following year. Crohn's disease features can affect any part of the GI tract, from the mouth to the anus, but most commonly affects the end of the small intestine, the ileum, where it joins the beginning of the colon. May appear in patches, affecting some areas of the GI tract while leaving other sections completely untouched. The inflammation may extend through the entire thickness of the bowel wall. Crohn's disease symptoms include, as the lining of the intestine becomes inflamed and ulcerated, it loses its ability to adequately process food and waste or absorb water, resulting in diarrhea and abdominal cramps, bloody stools, ulcers formation in the colon and rectum, fever, urgency to have a bowel movement, weight loss, risk factors of IBD, genetic predisposition, immune system disturbance, environmental triggers, smoking, antibiotics, non-steroidal anti-inflammatory drugs, and appendicitis. IBD complications: diarrhea and rectal bleeding, perforated bowel, toxic megacolon, skin and bones. IBD has a significant impact on quality of life. 67% of respondents frequently considered the availability of toilets when planning to attend an event. 60% felt stressed or pressured about taking sick time during IBD. 48% felt that their life was affected by IBD symptoms, even between flare-ups and remission. IBD burden. IBD can significantly affect a patient's quality of life. IBD has emerged in newly industrialized countries. From 1990 to 2017, the prevalence of IBD increased by 85% globally. More than 10 million people are estimated to be living with IBD worldwide. Having a chronic illness such as IBD can be emotionally burdensome. Feelings of anger, anxiety, or fear and depression. IBD results in a significant financial burden. IBD is associated with both direct and indirect costs.